Everyone, welcome to another new episode of the 4D podcast. So today we have with us very special guests in alphabetical order. So we have Darren Mitchell. Darren is the CEO of IES Academy and Labs. He specialized in orthodontics for 14 years. He started his first lab in Wimbledon, developed the IES Clear Smile aligner range, and is also considered the pioneer of digital workflows. Then we have Dr. Tiff Qureshi. Dr. Tiff is the founder and clinical director at IES Academy and Labs, past president of British Academy of Cosmetic Dentists, pioneered the progressive smile design concept, and you are also a mentor and international lecturer, and you take a lot of courses for global clear aligner brands. So, gentlemen, welcome to the podcast.
Thank you. Thank you.
Cool. So, I think let's start with the first question. So, while I was doing research on both of you yesterday and before, and I think I'm fortunate to know you guys from last few years, and there was a common theme that connected both of you, which was around you being early adopters in technology when it comes to dentistry. Tiff, you are very vocal about the usage of intraoral camera and the usage of that and simplifying things for dentists. And Darren, you introduced digital workflows in your lab. You introduced 3D printing for your labs. So when it comes to early adoption of dentistry, where do you see like dentists are lagging in terms of adoption? You being the early adopters, but in general, the dentists are late to adopt technology. So is that true? And where do you think the gaps are in terms of the adoption? Tiff, we can start with you if you want.
Sure. I think part of the problem we've got, obviously in this country, we've got quite a range of systems that the dentists work under. So, of course, if you're working in government healthcare system, then funds are tighter, patients' fees are lower, and so of course time is more restricted as well. So it's going to be harder for the dentist working in the health service, particularly, to perhaps have the the resources, the time, and justification to start getting 3D scanners and and intraoral cameras, etc., etc. Part of the problem, I think, is perhaps early on in at our dental training, there may be, this is where is a real opportunity for these things to become standardized. I'm still amazed right now that at dental school in the UK, students are still not using intraoral cameras. And bear in mind, this is technology going back to 1997. So I had my first camera in 1997, and I meet dental students or new trained dentists who still don't know who've never used one and have no idea. And I think that starts the problem, because that actually creates basically a lack of communication with patients, and so people can't see, well, what's the point of having it? So I think it starts there. There's kind of many other reasons later on, but it is something that I think really needs tackling for us to move dentistry on in the UK.
Darren, what's your take on that?
Yeah, certainly. But when we go back in time to when we first looked at this, I think there was people were looking at different systems, and I don't think they wanted to be investing in something they didn't know had a future. There was a few different brands around at the time, different cost centers. But I think on a commercial basis, I think they were resistant to investing money into a system they didn't know was going to work, or might be superseded by somebody else. And I think people were a bit reluctant to start off with digital dentistry or go down the route of bringing that into their labs, into their surgeries, because they didn't want to make that first leap without seeing what everybody else was doing. And I think that hesitancy maybe set people back. And it's hard to catch up, or it's expensive to catch up once you're left behind.
I was trying to get into is that the cost of the technology in dentistry that's way off, kind of disproportionately high as compared to some of the other industries? Is that what causes the lack of adoption, or is it just like they're not taught in school that technology is also part of your day to day?
I think it's a bit of both. It's a bit of both, because costs are perceived to be high. Actually, I think when you look into things, it's maybe not as unaffordable as you may think, but the reality is that it is often thought as something that is quite expensive, and there's a little bit of a barrier to actually getting one. I think people need to see the benefits and the reasons for going down that path, and actually really eventually understand that it's going to, in the long run, it's probably going to massively improve their dentistry and arguably save them money at the same time.
I think there's a tendency,
because we talk about education. Sorry, Tim.
I think there's a tendency for people to think of intraoral scanners as just an impression taking device. And it's not that at all. There's far more functionality to these digital units now, with smile makeovers, dentition, where all the different parts of the software now that make dentistry so much better, and making informing patients so much easier when you can show them the wear of their teeth over a number of years by actually having something on screen that gives them a charted flow of what's happening to their teeth.
Mm. And again, coming into the education side of things, that, how much of technology is taught or not taught in the dental school. You both are very well educated. You come from a very well educated families. As part of your IAS Academy, you teach a lot of courses. So there's a lot of emphasis on education and the right education. Where do you see are the gaps in the current education system in terms of universities, college, or schools, however you want to call it? Where does the role of the universities stop, and where does the continuous education, which is what IAS Academy is about, where does that start? So who's responsible for what kind of roles, and where, things stop from the previous one and you take the baton of continuing the education for the dentists? Tiff, do you want to take that?
Yeah, I mean, it's a difficult question. It's always easy. It's sometimes easy to kind of, blame universities, blame university education for not producing dentists that come out with enough experience. I suppose you can only kind of compare to what happened to us. I mean, it's absolutely clear now. It seems to be clear that that a lot of the students coming out of dental school aren't doing as much physical hands-on work that we were doing 15, 20, 30 years ago. For what reasons that is, I'm not entirely sure. And so, there's an argument that people just perhaps aren't coming out with quite the confidence. Now, there may be practical reasons for that. There might be legal reasons for that. I'm not sure. So therefore, we do need a scheme in place to actually take people on and move them on. Now, that can be, it could be the postgraduate training programs. It could be sort of private training programs. And I think there's obviously a clear market for this, and there's a lot of providers. I mean, ultimately, it's hard for people to perhaps decide, but I would say that, you've just got to look at the quality of the education that you're going for, and then also the mentoring that you may well get with it as well. So I would say that there are some things that I can see that university training could improve on. I think there are some concepts and some skills that dentists do leave dental school lacking, and one of them is basic photography. The other one is really understanding perhaps a little bit more about things like occlusion and some more basics of ortho. But all of these things can be learned pretty quickly and learned very well within the first 1, 2, 3 years of post-qualification anyway.
Yeah, and do you think, Tiff, that the like a lot of aligner brands, and all of them provide their education, and we'll go into details about those questions as well, that it's being abused because they're not being taught in school in terms of using aligner systems, the softwares, and a lot of labs, and I know so many companies that we work with, and everyone has. So you got education first, and then you combine the lab. So again, that's kind of match made in heaven. But then all the labs, they just add education as a lead magnet for the dentists.
Yeah, I mean, and I think you've kind of hit the point quite importantly, because if you aren't taught much about orthodontics, then you come out and then you're then wanting to use a kind of aligner brand, you'll go to that brand and learn something from them. But the problem is, if they're not actually teaching you orthodontics correctly, all you're really learning is how to scan and send the case. And this is what a lot of people don't understand. And there's a big bit missing in the middle. And the bit missing in the middle is that you need to know how to do a proper orthodontic assessment, diagnosis, treatment plan. And if you do that correctly, then actually your clear aligner prescription, and actually then the setup that comes back, is going to be way more appropriate and correct for the patient. And we see that, and that's clearly what we're focusing on teaching. But I'm totally aware that there are clear aligner brands out there who teach none of that, and really it's just about teaching how to submit a case. And ultimately, and we may get into this a bit later, ultimately that is putting the dentist at major risk for many different reasons.
Yeah. And Darren, when you see the cases coming into the lab, like, do you see a difference of quality of questions being asked, or the treatment plan being sent, accepted or not accepted by the dentist, depending on what level of education they had? Like, can you differentiate? Is it easy to differentiate when the dentists come back to you, or they just blindly accept, whatever the software produces for them?
Yeah, I think it's quite straightforward to understand when we're getting cases through the door, the level of education they've had, with what they're sending through. When we get something that just says please align, and nothing else, what they're trying to achieve is just letting us get on with it, and they're not sure what they're after. The patient's told them they want straight teeth, and that's pretty much what they're saying to us. But they're not suggesting a treatment plan at all. They're leaving it to our clinical team to point them in the right direction. It may be the case that they're sending a patient in that really shouldn't be treated with aligners in the first place. And it's all about the assessment diagnosis, as Tip discusses. It's choosing the right patient, knowing what to do with that patient, and having enough education to understand which patients you should be treating and which patients you should be passing on. And then if you are taking a patient on, what fundamentally you should be doing, and the correct orthodontics behind that, and not being led by a brand, but actually being led by geo orthodontics.
And do you see, Div, you mentioned about the risks about, just let's say saying please align, right? There's a huge risk, and we're talking about liability, and you are a dentist, and you also see the education and the lab side with Darren as well. So, like, what are the risks over here? What do the dentists do not understand? And what are the three things, maybe just three things that they should know before they are, submitting a case, or at least choosing which aligner system they have to go with?
Well, I think the first thing is by not actually assessing the patient, by not actually looking at various parameters of what this patient actually has, you will risk the potential likelihood, or perhaps you could end up with the teeth flaring more relative to the patient's lips. You could retract the teeth and pull the teeth out of the way. You could end up with a kind of reduced overjet, which doesn't suit the patient from a functional perspective. You can change the guidance and worsen the guidance. There are so many different parameters, and the whole point is, if you've done that assessment diagnosis and you've made you've diagnosed and assessed and noted certain features. Well, for example, if I know that my upper central tooth has exactly the right amount of overjet compared to the lower, and functionally it's correct, but all the other teeth are crooked, well, I may want to make sure that tooth stays in the same position, and that the overjet or overbite is changed to a certain amount, which is going to then improve the guidance. Now, that's my decision to make. If I just send that off to an align, say a please align, and you know what, even if I just sent it to a TPS, these treatment planning people, which is fine, but they cannot see the patient. So if you think that they are going to come up with an absolutely perfect treatment plan, you are dreaming. And this is the point. A lot of dentists sort of go on aligner plan courses, they completely then dismiss their responsibility, and then they push it onto somebody else as if they're going to come up with a perfect plan. But the reality is that they've got to understand they're responsible for that treatment. And we're trying to help people understand that if you take control of that case and you look at it and you assess and diagnose it properly, you will actually get a better functional result. And it isn't that hard to do. It just takes a bit of time to learn how to do it. So I'd say that there's little factors that are very important. From a danger perspective, the problem you'll get is if you've not done an assessment, a diagnosis, and a plan, and your case gets pulled for whatever reason, the evidence clearly shows that where dentists lose their cases, if you look at a kind of pie chart on what causes you to lose a case, it always comes from a lack of assessment, diagnosis, and treatment plan, and failure to communicate and consent. And that pretty much explains this whole, scan and send situation. And you might scan and send, and the patient might end up with aligned teeth. But if there's a complaint later on, and they see that you haven't done that assessment, diagnosis, or treatment plan, you're ultimately liable. And that's how people lose cases. I hope I answered that question. I might have gone on.
Yeah, you answered that question. And I'll just ask a follow-up question, right? So when we talk about all this liability and, all these things, like there are a lot of courses that people go to, and again, clear aligners is one of the ways where dentists are expanding their service offering as well, and obviously that impacts their incomes and everything. There are different formats of courses, and starting from a weekend course, an hourly online course, to maybe a master's or a diploma courses as well. What is the value? Is there a value of doing an online? Can they do something by just doing an hour, couple of hours of course, or that's just an introduction? Weekend is still okay, but then the ideal should be a couple of years or a diploma or a master's. I think a lot of dentists, and again, I have this dinner table conversation with my wife, who's a dentist as well. It's kind of what is good, and there's a lot of noise out there. So what's your perspective on that?
I think a lot depends on how simple the cases are that you're treating. And I would always say to people, if they've never done anything, just start off with doing simple 3 to 3, 5 to 5 style cases. Now, you can do a weekend course, but it shouldn't just be that. You then need ongoing mentoring. And that's the most important thing, because if you just go off on a course and then you haven't got anyone to talk to, well, then who's checking your assessment? Who's checking your diagnosis? Who's checking your treatment plan? Who's checking your digital setup? Are you going to? Well, I would say most people need some help with that. So in truth, any course you go on should have ongoing mentoring, even if you've only gone for a day, and even if you've only gone, for a couple of hours, you must have online mentoring or some kind of ongoing mentoring. Yes, I do think that the kind of longer programs, a year programs, we run one ourselves, are of intense value. But the way we've sort of structured it is we found that we want people to start off doing simple types of treatments first. And then when you start doing more advanced, more in-depth, year-long programs, well, that's really when you're starting to treat cases in a more comprehensive way. So I would say if anyone started, and you've never done any ortho, you shouldn't really be starting off doing comprehensive ortho. Just start with the simple stuff and then move to the more complex stuff once you've got a 2, 3, 4 years experience of that type of dentistry.
And they continue doing mentoring while they are starting with a simple case and as they're progressing to the next stage.
Even with the advanced stuff, you'll just have a different style of mentor. So we will have, effectively specialist orthos mentoring all the complex ortho cases, and some of the simple cases we've got very experienced GDPs mentoring them, which is perfectly okay, because actually a lot of those cases are ortho restorative cases anyway. So which is, and that's off, and those are, I would say, 90% of the work that most general dentists are doing and should be doing in the UK is probably just simple ortho restorative stuff, which is, simple aligner cases that are there to help stabilize the anterior occlusion and stop teeth chipping and breaking. And there's millions of patients that actually could benefit from that.
Got it. Yeah. So again, I'll go to the next question, and I want in that question, Tiff, for you to wear the hat of a dentist, right? Darren, from a lab owner's perspective and a lab technician's perspective, like that question should be answered from that. And the third is the use of the treatment planning software. So in a clear aligner treatment workflow, right? And that's how we kind of see things from our side, from Smile Genius side in terms of workflow is there is a dentist, there is a lab, and then there is a patient. But then there is a treatment planning software as well, which is very important in terms of treatment planning. And what do you think is the role of a dentist? So if you can answer that, and then what's the role of a lab, Darren? And then what's the role of a treatment planning software? And if you can tie it around in terms of what should a dentist know, Tiff? Should they be worried about who is the lab technician or which software they are using? They're not aware of the lab planning softwares as well. Should they be aware of? So let's start with, what's the role of a dentist in a clear aligner?
Absolutely. Yeah. So the dentist has to see the patient, diagnose the case, and then come up. The way we teach is to come up with a prescription that matches the assessment. So, like for example, if you know that an upper central tooth has the right vertical height, and we would call that a vertical landmark, for example, I would want to make sure when I put into my prescription that goes then to the planning software, please maintain height of upper central, move upper left central down to the same height. So it's like using little reference points or landmark points. It might also be something like, please, because of overlap contacts, please start the IPR in these spots and delay some IPR till later. So you have to kind of understand that that's what you want. Otherwise, you might risk having IPR starting on all the wrong positions and it to be more awkward to actually carry it out. So the dentist's role is to look at these things and to think, well, what does this patient need? Where does the IPR need to occur? Which tooth is in the right position? What's the patient's biotype like? Is it okay to procline the teeth? Is it okay to round trip the teeth? And then we're going to put that information in our prescription, and then we're going to send it to the lab. And I'll pass over to Darren now.
If you get the prescription right, it's very easy for a lab because you've got all the information. If you just write, please align, then if you don't send any other information, we don't know what the facial midline is, we haven't got the patient there, we're moving teeth to where we think they should be. And without any information, how do we know if we're providing you with the correct treatment? What we're doing as a lab is providing you with what you've provided us. So we're passing forward with a manufacturing site for the aligners. So we'll do our best to give you what you want, but if we don't know what that is, all we're going to give you is our best attempt at giving you a class 1 result. And that's all we can do. We can't, without anything else, we're just going to give you our best representation of what we think, having not seen the patient, and just seeing maybe a digital scan or some plaster models, what we think is best for those teeth. And then we manufacture and we send out, and if we're sending out via the platform, at that point is the first point where the dentists are going to see what we've provided and let us know whether we've hit the mark or whether it is some future plan.
That's right. And I think that's the point. So if the dentist has prescribed those things that they want, like midline, arch form, IPR planning, overbite, leveling, overjet, attachment positions, there's lots of different parameters that we will basically help dentists understand that they need to input at the beginning. Then Darren reads that plan. They set up everything according to what has been asked for. Then the software, then when we're looking at it, we go through those little parameters, and actually, with the Smile Genius software, we can actually check each individual point. Like, is my landmark point correct? Is the overjet correct? Is the IPR timing correct? And you can just go through the checklist. You think, okay, yeah, that's correct. And if it isn't, I'll get back to Darren and I will say, actually, do you think we can just adjust this or improve the or reduce it overbite, blah, blah, blah. That will be adjusted and then it will come back. That's the way to do it. And if you do it that way, with those initial parameters, lab following the parameters, the dentist checking the parameters and tweaking them, you will get a perfect result rather than please just scan and send.
Also, does it matter in terms of what treatment planning software is being used?
I think as long as the software, I think as long as the software allows you to see every step, it allows you to see what's happening to teeth as you're moving through, not just before and after. You need to basically see the whole thing animating. It allows you to see where the IPR is. It allows you to do a bit of measurement here and there or superimposition. That's actually all you need, quite frankly. And using those tools then allows you to validate all of those things and tweak them a little bit if it isn't quite right back with the lab. Sorry, Darren.
Yeah, I think it's also, when you look at the lab software, you're really relying on the person behind that. You can have the best software in the world, but if the technician working that piece of software isn't aware of tooth movement protocols, the staging of the tooth movements, then you're not going to get the result you want anyway. The software's not going to do it for you. They're not algorithm-based, the type of things that the normal labs are using. So you're very much reliant on the person understanding, first of all, what they've been asked to achieve, and then secondly, how to achieve that using the software they've got in front of them, which teeth can be held, which measurements they've got, which attachments to use, and to provide you with the best case scenario and the best aligners that you can have to achieve those movements in the smallest number of aligners possible to have a cost saving at the same time.
Yeah, and these softwares are just tools, and they are enablers for an outcome, right? Mm. And it doesn't matter, and that's what I'm hearing, right? It doesn't matter until it does the job, and what the outcome, which should be defined by the dentist, right? And unless they define it, there is no goal. What's the goal? Align my teeth, or align the teeth of this patient is not a goal. Okay, cool. So when we come to this, there are a lot of clear aligner brands and clear aligner systems that are out there. And IS Academy, as you know, and if you teach a lot of these top aligner brands as well globally. So what do you see are the similarities and dissimilarities amongst these? What are the common things that you're finding, and what differentiates them apart? And then I'll ask a follow-up question after that.
Yeah, I think what's interesting with aligners is that they're actually not all the same. A lot of people like to say aligners are all the same. Well, actually, they're not, and there's some differences that are very clear. Now, one thing that a lot of people are just not aware of is how the trim height and trim shape can massively change the outcome of aligners. Now, we're all used to, the global market leader in the design of that particular aligner. But quite frankly, if you have a flat trim line on certain cases, you could have, hardly any attachments on the teeth. And for certain movements, it's been shown that there's actually better outcomes with a flat trim line and with a high trim line. It's actually evidence-based. There's Journal of Clinical Orthodontics 2012. There's been several other studies as well that show that for certain types of movements, a flat trim line is way more optimal than a scallop trim line. And if you're wondering why that is, it's simply because, of course, a scalloped aligner is going to be a lot more flexible. Now, why use scallops and why use a flat trim line? I think historically, one of the problems with aligners was if you were taking impressions, you kind of needed to use a scallop trim line, because our worry was that we were going to be having a muco-compressed gum line. And if you finished it high, you would end up potentially causing soreness on the gum. Now we're using scanners. That whole idea is out the window, because you can finish the aligner height wherever you want and you won't create any mucocompression. So it gives, I find that, I'm not going to name any particular brands, but I find that the aligner systems all can do this differently. I think there's pros and cons, but my kind of gold standard case, so to speak, is to have as few attachments as possible. Most of my cases probably have 1 or 2 attachments per arch, and a flat trim line. And what that also means is that my cases are massively predictable. I meet people who are just used to doing 1, 2, 3 sets of refiners or a mid-course correction. That never happens to me. Okay, and it's really important to understand, because I am not going to go with one system just because everyone else is. I want to go with what is going to be predictable for me and best for my patients. So I think you'll see, actually, even over the next few years, I think we'll see, and maybe we'll get to this, you'll see this whole variance of actual aligners design starting to become quite a big thing. And there are similarities and differences between some of the systems. The software is a bit different here and there. Some systems also, the work turns up in a week, some it turns up in 4 weeks. So, all these things are quite different. But I think what I would say dentists should do is be very open-minded to aligner systems. And I'd probably suggest don't just use one. Do not just use one, because the more you experience them, the more pros and cons you're going to see, for sure. And
we should do there, just trying to understand, if someone has to choose, if I'm a dentist, right, I don't know, and I've only heard of 3 names who do kind of direct-to-consumer marketing. Is it the cost as a first factor, or is the education the first step towards?
I think cost is always a factor, and there are variances in cost. But I think education is probably important. Obviously we're biased. We would say, come on one of our programs and we teach you in a very open source, non-biased way. But at the end of the day, it's hard. I don't want to sort of say I'm using multiple, and I don't want to say one is better than the other. No, there's pros and cons in all of them, actually. There are a couple that I tend to use a lot more, but they tend to be based more around being able to customize my trim line and less attachments. And, that for me is, ultimate, because I don't really want to be spending ages putting attachments on, and I don't want to damage the teeth removing them. And I'll be honest with you, very, very few people, when they put multiple attachments on teeth, don't damage the teeth. Okay, there's I don't think I've ever seen a case where someone's had attachments on every single tooth and I've looked at the patient up close and they haven't scratched the teeth. Okay,
wow.
So it's just the way you've got to think about it. If I've only got 3 attachments or 2 attachments to place, I mean, there's a much better chance of me not damaging the teeth. And I think this is just something we've got to start thinking about. When kind of one system dominates, everyone just thinks that's the normal way of doing it. Well, actually, no, it's not. It's not the normal way of doing it, and it's just the way that they do it, and there are other ways of doing it. And I think that's what's nice about there being other systems, and even with IAS ourselves, and we make aligners, and we're just using different concepts and ideas, and actually tailoring it to our own aligners. And I think that's the way I think it will gradually move over time.
Yeah, Darren, what's your take on different aligner systems and how you position, like Tiff was saying, right? You kind of try to improve and experiment with different styles as well. So what's your take on the different aligner systems and the similarities and the dissimilarities?
Yeah, I think I've got to follow on to what Tiff said, really, because if you're stuck with one, how do you know you've got the best one? If you don't use the different systems, they all do something slightly different, as Tiff said. And not every treatment you've got is going to be achieving the same thing. You're not going to be using the same tools. So it's best to get out there and try different things. When we do our own stuff, we're trying to work on the basis that we want to use as many different concepts as possible because we want to give you the best outcome. So we use all of those different ideas in what we're producing, because if we just use a one size fits all, how do we give you the best outcome? So it's by using all of the different ideas and all of the different concepts. That's why we give you the best treatment. And as Tiff would be the first one to say, the ortho is part of the picture. That doesn't finish the case off. You might have moved the tooth to the right place, but there's so much more to do after that. I'll leave that to Tiff because he's the person that invented the system.
Yeah, I mean, I think what Darren's alluding to is that there's normally a quite a very important restorative element as well, and you have to accommodate for that. It's really rare that adults you'll just align their teeth and that's it. And quite frankly, if you just do ortho on an adult, I would put money on the outcome being not good enough, because to actually ensure you've got proper anterior guidance, discluding the back teeth, maybe K9 guidance, you've got proper correct envelope of function. So a lot of this stuff actually may well also involve some kind of restorative treatment as well. So I think all those brands, and using those different brands aside, anyone doing that has got to also think, okay, I've got to slightly up my occlusion knowledge and functional knowledge, and then a bit of restorative knowledge game as well, because there's no point just doing ortho. Otherwise, you're not providing the best result. I'm talking about for adults here. It does not provide the best result. It has to. For me, ortho, occlusion, function, restorative, it's basically all the same thing. I don't even see those as separate subjects. It's basically the same thing, and that's how you should see it.
Great, thanks. And I think you mentioned about the envelope of function. I remember the first day when I sat in your lecture, and I think it was in Birmingham Dentistry show. It was the first time I learned something about something called as envelope of function. I'm not a dentist. I come from a software and a business background. And I sat through a lecture and I understood everything, and I came back educated, and I was able to impress my wife. And do you know about the envelope of function? And, but yeah, I took some keywords and I was able to impress at home. So thank you for that. But you have a very good style of, and this is not because you are in this podcast, but in general, communication is very important for a dentist. But you being a lecturer, not coming from the dental background, I was able to understand at least half of it, but not the clinical side of things. That this is 2 years ago, 3 years ago. But I think that's a really good style of kind of making people understand and not to run away from the concepts, but embrace the concepts as they are simple and easy to understand.
That's good feedback. Thank you.
Cool. Let's come into the last two questions. So I usually ask that question with everyone. It's, what are the trends that you are seeing? Now, it could be dentistry in general or clear aligners. You can choose whichever you want to say. So what are the 3 trends you are seeing? So Darren, we'll start with you first.
New issues too.
Any top 3 trends that are in top of your mind? See, I surprised you.
Yeah, you did. I think there's certainly people that are wanting to do more aligner treatments. I think people see that as a real bonus for their practices. It's something that they can all achieve. I think with the right education, is something that people want to push forwards. And I think people understand that to be able to do this, you do need that education. It's just finding the right provider for that. So I think that's kind of point one is clear aligners. People are moving down that way. Digital dentistry. I think there's a big push towards digital dentistry, and point three would be adding into that is AI within dentistry, using different brand softwares to help you detect caries, help you with your diagnosis, note taking. So I think the two, point two and point three together, the move into a digital culture, is really where people are heading. And some people, if you don't adopt that quickly, you will get left behind, but it can really help the practice. It can help you move forwards, help you improve your day, and really push your practice forwards. So that'll be my three that I see.
Inside, Ed?
So sort of trends that I'm seeing, well, obviously, I mean, a big one there out there is social media and how important social media is for dentistry. I don't like social media, but I'm on it all the time, and I'm doing it, in a way to try and educate dentists. I can see how important it is to reach out to patients. We do that within our practice, and that's now really where most people are. And even those platforms change. You can see how things have changed from Facebook to Instagram, and now a lot of people on TikTok and all that kind of stuff. So I think you've got to be social media aware. I think the positives of social media, there's a massive reach and it's very low cost. I think the negatives are that there's questionable professionalism, and I think we've got to be really careful about the kind of things that we are seen to do. It's very easy to think, oh, well, in modern times, whatever, we can just do on. But actually, at the end of the day, we're dentists, we're professional, we're healthcare professionals, and I really sometimes I'm just slightly uncomfortable with what I'm seeing. And I just hope that ultimately dentists always remain super professional online on social media, because it is a massive tool. The second thing I'd say is I'm seeing a trend. Well, I'm biased now because this is a trend I'm hoping to set, but I'm hoping that people start to appreciate that dentistry is more than just about doing something now and what do I get out of it. It's about what you're doing for someone's whole life, and this I call it the lifetime approach. So when I'm doing aligners and I'm doing ortho restorative, I'm going to follow that patient, and I know that 15, 20 years down the line, that patient's teeth will be in a much better situation than somebody that didn't have the treatment. And I'm hoping, as a trend, that thinking ahead, like if I don't treat this person now, what's going to happen to their teeth? What direction will the teeth move? Where will the wear occur? How will the bite change? How will the envelope function change? What am I doing now that's going to save somebody a problem later on? So that's a sort of, that's my trend, which I'm trying to push out there. And so I'm going to drop that in. And then I think the next thing that's going to come along is real, true, full healthcare within dentistry. And what I mean by that is not just talking about your teeth and your gums, but actually understanding that the mouth is fully connected to this whole body, and that actually that there's a lot of what we call metabolic disease around that is driving a lot of the dental problems that we have, and that actually as dentists in the chair, we have a huge opportunity to perhaps screen patients for all sorts of problems. I think, a bit of a political thing to say this, but dentists don't have the bias and influence that medics have with regards to treatment, because unfortunately medics are ultimately, a lot of their education comes from pharmaceuticals. Ours doesn't. We are able to, think more about prevention long term. Doctors don't really talk about nutrition and diet or anything, quite frankly. I mean, I know I'm going to have people say that's not true, but from a family full of doctors, and I know lots of doctors, their understanding and education of nutrition and diet is quite frankly poor. And, I think that it's our place, or one place perhaps, to start to push dentistry into true healthcare. The more I understand about this now, the more I realize that there's so much more that we can do as dentists that are going to help patients' teeth, but will also help their entire body. And I think things are moving in that direction for sure.
Great. No, I think thanks for sharing that. So we'll move to the last section. And I think if that's kind of an extension to what you just answered in terms of, I know that you have a lot of interest in general health, metabolism, and how that relates to dentistry, which is an offshoot of what you generally study. I was supposed to ask you a different question, but I've changed it. So how, just to give you a surprise, right? How do you detach yourself from dentistry, or let's say a bad day or a good day at work, and a patient's case, let's say you have when you go home in the evening? So what is your method of detaching yourself when you are back home, or in a typical day as well? I hope you understand my question. So I think just trying to understand what people can learn from, in terms of, if that works for you, it could work for other people as well.
Yeah, absolutely. I think doing things you enjoy, which could be doing some gardening, walking the dog, all these sort of things that are kind of like almost like kind of meditation things are important, where you're completely separating yourself from what your day job is super important to do. I've spent too many years not doing that, and coming home, sitting in front of my computer, working on treatment plans or writing lectures. And now I've kind of got to the stage where I can separate that out. I think I found in the last 1 or 2 years that actually exercise, sounds a bit boring, but actually exercise and sort of physically, literally weight training has become almost therapeutic for me. It's quite strange. I used to think that would be a huge chore, but every day now I'm just kind of, I'm almost addicted to it. And it actually is, I find it completely relaxes me, makes my mind stronger, makes me sleep better. And I think it's, combined with, finally understanding how to eat correctly after all these years, it's working really, really well. So I think detachment's important, and it could be watching a series of whatever with my wife, and then you're just not thinking about it. And I think what's really important is putting your phone and your social media and all that sort of stuff just out of reach for a few hours. And one tip is to put it down 1 hour before you go to bed if you want to sleep correctly as well.
Thanks, Darren. Yeah, I kind of echo that, to be honest. I think you have to have that work-life balance. And if you can separate yourself from that and be able to switch off when you leave the office, I think it leaves you in a better place when you come back to the office. If you dwell on things all the time and you're always mulling things over in your mind, I think sometimes you can overthink situations. It's better to come in with a fresh start and a fresh look on things. It's tricky. The things that take you away, that, like Jeff says, if you can de-stress in a way that takes you to a place that's your happy place, mindfulness, it's just whatever that one thing is that is just you and your time, or you and your loved ones, then that's the place to be at. And having that separation, so that when you are in work, you're in work, and you don't need to think of the stresses of anything else, because you've given that your proper time. When you're at work, be at work. When you're at home, be at home. But have a definite definition between the two.
Great.
I like just one thing, and I'll say that. And the more you are communicating well with your patients, and the simpler the treatments you do, the less stress you have, and the less you worry about it. That's the reality of it. So so if you're doing everything kind of correctly in your office, because you set everything up in that situation, you can have then you'll always have a good day, and pretty much very few bad days. And then you go home and you won't even be thinking about it. And I think that makes the separation even easier.
Great. So let's end the podcast with that note, Tiff. So, gentlemen, thanks for your time. I know you both had been extremely busy, so I'm really thankful that you took time, said yes to coming over here, and being honest with all the answers, very clear. Thank you. Thanks for your time. And I'll hope to see you soon someday.
Definitely. Thanks very much.
You.
Ethan. Much appreciated.
Thank you.